Good afternoon, good evening, good night, good morning, live viewers. Welcome on into the Mental Health Hour, episode 18. Hello, Gemma. How are you?
Hey, not too bad. Happy haircut
And,
day.
oh, yes, the haircut day. And, hello to Molly and Hannah and Knowledge a couple days ago. And a hello to all the replay viewers that's coming. And there's Ella, one of our active sponsors here. So, today, we have another great episode for you. We are going to be joined here momentarily. Hi, Mom. We're going to be joined here momentarily by one of the platform's premier stars. Um, she, we are all dealing with mental health issues, mental health in some way, shape, or form, depression, anxiety, substance abuse. Uh, these all affect our lives from day to day. And, some more than others. But the COVID-19 pandemic has been something like nothing else we've ever experienced. And it's just fueled this fire, if you will, um, for the mental health side of things. So, without any further ado, let's bring in our guest, Doe, darling. Hello, Doe.
Hello, hi everyone. And yes, Gemma, your hair looks amazing.
Oh, thank you.
You're welcome.
So,
Hi.
Doe, uh, how has your mental health, we'll just get right into it. How has your mental health been affected uh, by this pandemic? It's something like I said earlier, we have not dealt with this or dealt with anything of this magnitude before. Certainly, I feel like we've all, in some way, shape, or form, have some depression or anxiety that we deal with day to day. Would you say that's true for yourself?
Yeah, it's certainly true. And I was just thinking the pandemic, I don't think there's barely anyone that hasn't been affected in some way, especially with their mental health, whether that be, like the financial stress, losing a job, losing loved ones, the isolation. It has been really tough for everyone. And any, mental health problems that you may have had seem to have been, exaggerated during this pandemic and just made it even harder for those to deal with.
Yeah, absolutely. It's been quite a uh, quite a crazy time, to say the very least. You know, I myself have been going through, obviously, as you all know, in the audience, um, my mental health throughout this past year and a half, and the pandemic certainly has not made it any easier, especially because during all of this, my work has not shut down at all, and if anything, I've gotten more work out of it because we're still having spike numbers over here, uh, which is putting firefighters off duty, quarantined, and then we can't let those um, positions go unfilled. So sometimes I just don't get to go home, and
Right.
trying to deal with mental health on my side, keeping myself good, but then overworking has been quite a struggle as well. Do you, Gemma? Uh, do you have anything going on with the pandemic on your side with mental health, with your
um,
own?
oh yeah, definitely. Like with everything that I'd already been through, and then being told that you can't go out, and then because I was high risk anyway and had to stay in, and then trying to keep on top of it for Thomas's health, and literally going to the extreme of sterilizing everything that came over the door threshold. It was driving me crazy, and I ended up making myself ill with it because of stressing about what I was bringing into the house and not being able to go out, being physically trapped in the house. I think I didn't go out for, apart from the hospital visits for chemo, it was a good 4 or 5 months. continuous. So yeah, that didn't help.
I can definitely relate to that because I actually have germophobia, and I know a lot of people don't necessarily take that so seriously, but it has really at times affected my life, like in a really bad way. So for someone that has germophobia and to be in a pandemic, it has been incredibly tough and stressful for me. During the whole pandemic, my partner was classed as a key worker, so he had to work throughout the entire thing and with the public, and he was put in these situations, and I couldn't control it. Like, I just wanted to keep us safe, and I couldn't control, when he was outside of the house or what he was like bringing back into the house. And so, yeah, I was the same, having to like sterilize everything, clean everything. It just put my like germophobia into overdrive, and it was very stressful just trying to keep safe. I felt like I was in sort of like a survival mode during that time.
Mm-hmm. Yeah. And the hospitals, I mean, they're doing their best, but they're just overrun right now, especially over on my side of the globe. Um, Still today, we're walking in, bringing patients in on the ambulance, and just so many people are stopping in, even with symptoms of the COVID-19, or at least one thing I can say is that things seem to be they seem to be being handled a little better. Um, when this all first started, it was very unknown what we were dealing with, what would happen if you got it. Everybody was very scared, obviously.
Mm.
But now I feel like we've got a better grip on what we're dealing with. We just don't know how to control it, per se. Um, so, do you have any other things for the COVID-19 pandemic in general that you'd like to talk about, Dad?
Well, it was,
Oh,
I can only talk about like my experience, and I like I said, I felt like I was in some survival mode. Now, I think one of the worst things that you could do
can
during
you
the
hear me?
pandemic was yeah, I can hear you.
Yeah.
Oh, can you hear me?
Yeah.
Oh, was like doom scrolling. Like, we were like, our brains were infiltrated with all this information, all this like negativity, during the whole thing. And while you wanted to keep up with what was happening and be informed and keep up with the news, there was at times when it was just too much. So one of the things that I decided to do last year was I started a Discord group, and the one rule of the group was no talking about the news. I just wanted an escape from the news, somewhere that we could go where we didn't have to think about it. And I feel like it was really helpful to a lot of people. We just shared memes and cute pictures, and I started a art club, and we had weekly competitions, and I loved seeing everyone's art, and I created some amazing art at that time. And that was just one thing that I did to keep focused and to help me and my friends just keep our minds in some kind of positive frame of mind. I think Tim's got a few little technical issues.
there we
Yeah.
go.
Oh, you
Oh,
see.
are we back? Awesome.
Yes.
I don't think we
Sorry
can
about that.
do a broadcast without some sort of technical problem.
That is
Like,
true. There's always something.
yeah, but yeah, definitely with what um, definitely with what you were saying. Like, I know from the hospital side as well, it's put everything on hold. Like
Oh my
Thomas had his
gosh.
chemo appointments cut into half, and then they reduced his chemo to less than a quarter. And then everything I've had has been cancelled, and even now trying to pick it back up is just ridiculous.
That
But
has
then,
been one of the like tough things for people
mm,
that don't like have other things that they need the NHS and need dealt with, not being able to get those
mm,
appointments because the NHS was so overrun. I know,
mm,
like, during the very start of the pandemic, I got diagnosed with a lifelong condition, and I couldn't get any of the help until now that I
Mm.
needed. So I was just left. And when I had to go to hospital for an operation, and it was very stressful having to go by yourself, take the COVID test.
Yeah.
And it was just like a very traumatic experience, especially when I'd had to wait like 8 months in like excruciating pain every day. And when you're in that kind of pain, it's very
Mm.
hard to keep positive and keep going. The days when you wake up and you're just like, I can't do this anymore. And then when you have the pandemic on top of it, like it's just a hard time. So I really feel for all those people. Like I know Gemma as well. You were like struggling so much wanting like to get those appointments, and there was just like kept getting pushed back or delayed. And it's
Mhm.
just been a really stressful time for you as well. And when you're in pain like that, I can just imagine it was so tough.
Yeah, yeah, and it certainly doesn't help to your like it doesn't help your mental health condition having to both wait for the appointments that you've been waiting for so long already, but then having to go to the hospital by yourself.
Yeah.
Like literally the other day, I had to go for a scan to be sedated. Wasn't allowed anybody in with me, so I was already panicking about that. But then you can't drive home, so like it's just ridiculous, and it's
One of
like
the most like heartbreaking things for me was my brother got diagnosed with cancer, and I remember he was taken into hospital
mm,
and no one could be with him, and he was just on the phone like literally begging for my mother to come, and she couldn't go. And it was just
mm,
like it absolutely broke my heart because there was nothing I could do, nothing she could do. And I know that situation happened for so many people, and
mm,
like so many people were losing loved ones and they couldn't be there for them at the time. And
mm,
it was just absolutely heartbreaking. And all that trauma, like so many people have experienced during this time, that's going to take a long time to,
mm,
to get better from that. It's hard.
Absolutely.
for
Yes.
real.
And
I
yes.
know. I was in the hospital for 2 weeks during the first lockdown, and because nobody could come and visit, so like Thomas couldn't come and visit me, and he actually stopped speaking to me. It took me nearly 4 days to get him to speak to me when I got back. He just didn't want to know. He became selective mute in the end and had to have appointments for that as well because he wouldn't speak. And he thought that I'd left him. I ended up giving him my old phone and stuff so that we could talk, but in the end, he just stopped speaking to me.
I
And
can't. Sorry, I was just gonna say I can't imagine how it has affected children as well because they don't fully, understand what's going on. It must be so
mm,
scary. I try to imagine me as a child at this time, and I just think it's
yeah,
so hard on everyone, but especially like you said, like Thomas, he didn't really understand what was going on, and that must just be, especially with everything that he's like going through. It's just another thing, and that must have been so tough.
with everything, with all the children not being able to go to school, not knowing what was going on, having to have the
Exactly. It must have
lessons
been so scary.
over.
It's so scary. So
It,
scary for them.
the whole world was literally turned upside down overnight, and no matter what you say to them, you don't
Absolutely.
want to say too much to upset them and worry them, but then you can't say
Exactly.
anything that will put them at ease or anything and make it any more understandable.
It's hard to understand what's going on at that age, with
Mhm,
anything. But then again, also, there's they might be young enough that they don't have much to put it up against. They don't know.
mhm,
Some of them were of the age where this was the norm. Um,
mhm,
uh, so, and then all the schooling that I know we've had to do, the online schooling all last year. My stepkids are back in school this year, but that's a bit of stress added on to the parents as well, um, because I particularly was trying to teach all these classes to middle school and elementary school kids, and I didn't go to school to be a teacher. I don't I don't remember. I'm a firefighter. I can teach you that stuff. So, I mean, there was that added stress as well, and the kids don't know any better. They're just trying to do their best. So, it has to be an absolute culture shock to, especially the high school kids who are getting ready to go into their senior years and stuff. And
Mm.
these are the formidable years. Um, but yeah, and it's the economic downfall that we've sustained over here has also thrown people into a world of depression. And uh, it's just when you lock down an entire country or globe for this matter, you telling people they can't go out. And I don't know about you guys, but to me, isolation and detachment were two of my worst things that I was doing to myself. Isolating from the world and detaching away from everybody was
Mhm.
just fueling my depression. Do you guys feel the same?
Oh yeah, definitely.
Yeah, for sure. I feel like I'm feeling it even more this year. Like, as humans, we are social creatures, and even though I am an introvert, I still need to be around people. And I think on the first year of the pandemic, apart from, the hospital visits, I only saw like three other people once. And like this year, I've only seen two people. Like, that's the only interaction I've had, like, with people. So I'm really, really missing that social interaction. But I still have this, even though like I have my two jobs, and everything, I still have this anxiety to meet up with people and be around people. But at the same time, I have a real need for it. Like, I am missing this social interaction. I'm missing being out there,
Mm.
around people. It's tough. It's tough being isolated for so long, and it does nothing for your mental health, being because all you have is yourself, and then you start overthinking, and you don't have any kind of distraction from it. So it is tough being like cooped up.
And I feel like we could all deal with this, together if we had some sort of end in sight. Like if they were to tell us, okay, we're going to lock down and it's going to be for 2 weeks and it's going to suck and we're all going to get through it. And then,
Mm.
once that 2 weeks is up, we're good. But there's just no end in sight still. We're a year and a half later and it still feels
Yeah.
wide open.
I think the only thing for me is the hope that I just remember that, like, everything, change is inevitable, and everything is a cycle, and nothing lasts forever. So I know there will be a point where it won't be like this, and I think that's the only thing that really keeps me going, because normally I do like to have like an end date to focus on. Then you can get through something, and when there isn't that end date, it can be hard. But I just remember everything is a cycle, and it can be tough right now, but things will get better and things will change. So that's how I personally see it.
Yeah, absolutely.
Mm.
Shema, did you want to touch on any of these slides that you have?
Yeah, I've just noticed that one was a double up, so I'm just messing
Oh, okay.
around. Um, just ignore the fact there's a number missing. Yeah, so I've pulled off some slides that is from the actual charity that you're raising money for. Do you want to talk about what you're doing, raising money?
Well,
Yeah,
yeah,
and then we
so
can go into that.
it was last year in the start of the pandemic last year. um what actually really got me into walking, because previous to this I wasn't walking. Like, I was doing like 150 steps a day. Like, I walked to the bathroom and back. I wasn't moving. But when I developed the nerve pain in my arm, and it got to the point where I couldn't do anything anymore, like that I love to do. That was something else that was really tough during the pandemic. I couldn't do my art, I couldn't do my music, I couldn't play instruments,
Mhm.
and everything I loved, I felt like I lost at that point. And it was extremely tough. We was in a pandemic. I couldn't go out. I couldn't socialize. I lost everything I love due to this chronic pain, and waking up thinking, oh, so what do I do now? There were times when I just cried like all day because I didn't see the point in even waking up anymore.
Mhm.
So I thought to myself, well, I need to find something else I enjoy, something else I focus on. And I was like, well, my legs still work. So why don't I try walking? And I started walking, I started hiking, I put some music in, and it was like meditation. I used it as a type of meditation, a type of therapy. Like I would talk to myself as I'm walking. You could have a really great conversation getting out all your feelings while you're walking, listening to music. And that's when I decided to take part in Miles for Refugees, where I raised money for the British Red Cross. And I think we made like £750 last year. So that's why this year I thought I'd do the similar thing, but this time raise money for Mind, because I know how important mental health is and how much people have been struggling. So I thought this would be the perfect charity to raise money for. And for me, getting out in nature and walking not only benefits, like me physically, but it really benefits me mentally as well. So that is why, I decided to do the 100 miles in October that I'm going to be walking. So for Mind.
That's amazing. And
That
I've
is
pulled off
awesome.
some slides on here. I'm just going to pop them up if I can remember how to do it. Hang on. So these are actually taken from Mind itself, and I'm just going to pop them up. There we go. So let me bring it up here so I can see them themselves. So the first one on the top left is relating to have you accessed or tried to access any services for yourself during the lockdown period? And it was like the first one, yes, I accessed support. Yes, I tried but could not get access. No, I did not want to or need any support. And then no, I did not know how to access support. And then no, I did not think my issue was serious enough. And then other. Now, when I looked into the no, I did not think my issue was serious enough, a lot of people actually answered that they were concerned that others were more important and didn't want to be a burden on the system that was already overloaded with that. The bottom left one, does age change how loneliness impacted the mental health during the lockdown? And this slide shows the ages that were of the surveys they did, which was thousands and thousands of people that they actually asked. Under 18, 18 to 24, 24 to 34, 35 to 44, 45 to 54, 55 to 64, and 65 plus. So looking at that, the age that was impacted the most was the 18 to 24, and then slowly, like quickly followed by the 25 to 34. So it did seem to impact the younger generation a lot more. Looking at the top right hand statistics, concerns that negatively affected mental health. So there was the BAME people and then white people, and it said that employment was the biggest concern for everybody. Which it would be because of like lots of people losing their jobs, lots and lots of businesses, particularly over here, were struggling to actually keep going, and many went bust. Then finances was the second most concerning. Getting physical health support and then caring for somebody else. And then the bottom right slide, overall, how well do you think you are coping with the stress related to the coronavirus during the pandemic? And it was the total population in red, and then the 18 to 24 year bracket, because that was the one that they deemed that was the most affected in this. And then I'm just going to pop this one up here. Just gotta find it on my screen so I can see it bigger. Like I'm not gonna go like over this excessively, but again, the it showed that they'd on this one aged 13 to 17 and then 18 to 24, and it was in relation to the things that they were having struggle with, and how many, this one was how many people had contacted the either Mind Charity or other mental health services, and which was on these statistics here. So school pupils alone was 8,819,765 during the pandemic that had to reach out for mental health support. And then it was about people with pre-existing conditions that already had to reach out, things like that. And then the age groups that were affected again, which it was mentioned before, it's just a different kind of graph. And then it was saying, how has your mental health changed in the past 2 weeks? And it was like much worse. A lot of people said it was worse. Same, very, very few said better or much better. But the people that said better or much better is because they were getting to spend more time at home. And I guess it was depending on what job they were doing, which would give that answer. But anyway, this one here, let me bring this one up. This is the number of calls that Mind Charity alone received, both before and during the COVID pandemic. The red being before, so that was the years 2017 to 2019. And then during COVID in the blue, which was just April 2020 alone. So right in the middle of it all that was happening, and that just shows. And it said some of the biggest concerns: psychological distress, loneliness, binge drinking, drinking on typical drinking day, alcohol frequency that had increased, smoking, number of cigarettes increased. And it's just some of the things that people were saying that had been discussed during and being struggled with during the pandemic. And then this last one here, and again, that's just a quick view of the number of people again, COVID generated admissions and referrals to the mental health service. And then other things like people that had already been in the system, and then the ones that had been generated because of the COVID pandemic. And it just shows that it's added a massive, massive impact to the services that were already stretched. And I say these are just based in the UK. So
Right.
anyway, there we go. Sorry.
Yeah, I think. Sorry, go on, Tim.
Oh no, that's okay. I just you touched on a lot of good stuff there that is also very transferable over to the United States as well. Go ahead, Joe.
No, I was just going to say, and that's why you can see Mind is so important. They're a really great charity, and I was just reading that they responded to like 119,000 like people's calls, and they like online. They're like really important charity, and one that I really, really do believe in. So I hope we can raise some money for them and help people out with their mental health, because there is a lack of support for mental health here in the UK. I don't know what it's like in America, probably the same. So anything really helps.
Yes.
I'm just putting it
Especially,
in the chat now.
yeah.
Thanks.
It's
And
just
we've thrown it in the chat a few times.
I'm
The link to
trying.
help support Doe on this 100-mile walk. And what is that? 160? Is it 160 kilometers?
Yeah, I think that it works out as that. Yeah.
So you're doing
So
this over the month of October, is that
yeah,
correct?
so it's 100 miles during October. So yeah, I'm a bit like but we're
Do you
gonna
have a
do it.
game plan? Like, are you thinking like a certain amount of miles per day, or?
I worked out it's about like I think about 3.5 miles a day, but you know, there's with my chronic pain, there's like some days I can't, so I'm just gonna try for the most miles I can on the good days, so we can make up for any down days. So yeah, it's just gonna be walk, walk, walk this whole
Right.
October. Like I'm not gonna stop, and I'm gonna be hapsing a lot of the walks, so I can take
Oh,
you all
awesome.
with. So that'll
And I
be
want
Yeah.
to
fun.
I do want to touch on that momentarily, but let's go ahead and throw up your video here that you created real quick since we're talking about the walk. Here's a video from Doe.
Don't you quit. You do make a difference. You do make a difference. You do make a difference. As weak as you are, as tired as you are, as many mistakes as you made, you do make a difference. There is something they would lose if you were not there. There was something that they would miss if you were not there. You do make a difference. You do make a difference. Don't you quit.
That's
That
so
was
awesome.
thanks. That was some clips that was taken from one of the walks I did on Haps, and yeah, I just hope the message gets across that just keep going, and you do make a difference.
Absolutely. Hi, Jim. Thanks for the award. Thanks everybody for the award, and thanks for stopping in tonight. Haven't
I
really
feel
been
like we've neglected the comments.
haven't really been in the comments too much tonight, and I apologize for that. But I do let you guys know that every time we do a broadcast, I do go back and I look through all the comments and I try and respond to folks. So I might not catch it until after the show, but I'll definitely get to the comments as well.
Hi Jim, hi Danny, hi Vito, hi Molly, hi David, hi everyone. If I didn't say hi, I appreciate you being here, so hi.
Yes, we appreciate everybody, and we really appreciate the awards, and definitely our active sponsor, Miss Ella. She's here tonight as well. You can see her bunny rabbit
Can I
here.
just say how cute that bunny is with the little glasses? Like, I think I'm in love with that bunny. It's so cute.
Yeah, mybunnyvalentine.com. Yeah, you can use the fire dude 15 code, and you can get 15% off
Oh,
this guy.
nice.
Yes, but so going back to the hapsing your walks, I am intrigued by this because it plays such a great role into tonight's conversation. I saw somebody, I think it was Ella, actually mentioned earlier in the comments that this platform and live streaming in general has really helped a lot of folks through these times of COVID-19, through these times of isolation and detachment and being locked down. We can still come together and still be together as a family on here, or get together and talk about anything, just be social still.
Yeah. It's the only way
Well,
some people have got out as well to be able to see some of the world or just out.
yeah.
So I know that's certainly helped me. But yeah, it's
Yeah.
Can you
So
imagine a time if this was like a time when we didn't have, this kind of social media? That would have been even more tougher. And I just want to say like a big shout out to all the creators and all the people that live stream that have kept me certainly and so many people entertained and connected throughout this. Like you have like helped so much when you probably didn't even realize, just being able to come on here, chat with people in the comments, whether you're a streamer or a person that's just in the comments, just having that social connection so you don't feel so alone during this time has been incredibly beneficial. So shout out to everyone.
yeah, absolutely. Um, it's just been a great thing to be a part of, myself included. This has been an outlet for some stress, or stress relief. Getting to come on and talk about this every week, or just hanging out with Ella late at night, doing some fun drawing and grounding and all that stuff. It's just been a wonderful um, additional thing that we've had here. This platform has really helped get a lot of people through the pandemic. So the fact that you're going to take us on your walks, with some of them at least, do you have any plans for any good sites or anything to?
Well, I'm quite lucky that I live in, right near quite rural area, and there's some lovely locations around me. I think it probably be raining a lot of the time, but that is not going to stop us. It is England, it is October, but it's autumn time as well. So all the leaves, I am ready for spooky season. So I am really looking forward to getting out, checking out that nature, getting some fresh air, and hopefully, maybe, possibly a little bit of sunshine. We might get some autumn sunshine, but yeah, I one of the things I've always loved is going out and taking everyone with me as we go walking, because I love nature, I love being out in it. For some people they can't get out, so I feel like this is a nice thing for them to like watch and enjoy when they can't get out as well. I certainly love watching like nature and like travel broadcasts on here as well, just to see different places. And when I'm stuck in bed and I'm like in pain and I can't get out, just being able to watch people out and about, it just makes you feel less alone, and it's just entertainment. And hanging out and chatting with people and having a laugh with your friends, they do say like laughter is the best medicine, and to
Yeah.
some degree I do agree with that. Like, there's nothing that makes me happier than just chilling out with my friends, even on here, having a laugh, having some banter, having some jokes, and just forgetting, just escaping from everything that's going on. And this is like a great escapism for a while, just to have a bit of a stress relief. So, I really do appreciate Haps and live streaming and everyone on it.
Yeah, for real. I can relate to that as well, because for quite a long time this is literally all I had, and to have everything that's going on, and then just to be able to shut off and do my own little bit on here, because I can't go out or anything when he's in bed and stuff. It meant a lot. And then when we did that for my birthday the other week, that was super fun, and just to be able to laugh, like you say.
I know, that was fun.
Yeah, like it actually laughed till it hurt at some point. It was so
Yeah, I
super
think you said
fun.
your face was aching by the end
Yeah.
of it, so that's when you've had a good night.
Yeah, for real.
Yeah, Melanie says here, the first year in lockdown, it kept me going.
Mm.
Yeah, like I said, I really appreciate it for live streaming and everyone on here. It was, it was such a big help to not feel like so isolated.
Yes,
Hi,
exactly.
Eric.
It definitely took that down to a level that was more manageable. Like I was talking about earlier, just being isolated inside without any end in sight. Being able to hop on here, I think, has helped a lot of folks, and especially young adults, to be able to express themselves as well. And everybody's been super active and super awesome on the platform. So yes, a major shout out to Haps and everybody. For those of you just joining in, we're welcoming in Doe Darling tonight. She's talking about her walk for mind, mind for the mental health walk for 100 miles over the course of October. There's links in the chats. We'll keep them coming throughout the show as well as they disappear. But yeah, is there anything else you can tell us about the walk or anything?
Well, firstly, I just want to shout out everyone that has sponsored me so far. Like, I really appreciate it and your encouragement. And I actually put together a public playlist. So if you check out my Twitter, you can add your favorite songs to the playlist to help motivate me, keep me walking. And it's actually been quite interesting to see what songs people add. There's been some funny ones, some very disturbing ones. We won't go into that. But yeah, so if you want to add a song to my Spotify playlist and help motivate me, keep me walking, share your favorite motivational songs. Because music is one that has throughout my entire life been a bit of a savior for me. I am a big music fan. I love music. I don't know where I'd be without music. Again, that's got me through so much. So yeah, if you want to add one of your songs, no, Danny Bruno, then yeah, feel free to do that. I thought that'd be a bit of fun interaction and a bit of motivation because music motivates me so much, and I have a lot of miles to do. 100 miles. Damn.
Music is another saving grace to many people. Uh,
Mm.
that we can talk about for hours on here, I'm sure. Just all of our favorite songs. I know you're a big Queen fan, and
Yeah.
I'm gonna have to get on and see if I can add a song or two for you on your walk.
Oh my gosh, yes, that would be good. Like, I'm actually really interested in, hearing people's. I think there's something very special about like someone's favorite song, and it says a lot about them. So I'd love to hear people's favorite song, and what it means. So yeah, I was really interested in people's favorite songs.
Does it show
One,
you who added them, or?
if you have a Spotify account, then and you obviously use it, and it has your like name or whatever on it, then
Okay.
it will say it's. So I can see who's added it, but
I might have to add one for you then.
yes.
So a couple of things we haven't really touched on with it, and this might not affect as many folks, but this one affects me in general. The the COVID-19 pandemic and everything that has come over us and isolated us, detached us, and increased that depression has also fueled the fire for substance abuse in many folks, and that myself included, um, was definitely intensified by this pandemic. It was much easier to just stay inside and hide. You didn't have to pretend to be, able to go around. So you could drink a lot more. I could at least, and I didn't have to drive anywhere and all that. So, I mean, there's a number of things to look at with substance abuse, as well as unfortunately, that will bring up the suicide rates. Last month was, or this month was Suicide Awareness Month, um, and then the essential workers. Also, I wanted to touch on that have been on the front line since the start of this. Um, just what an amazing job I think everybody has done as a community. Those that have had to, stay at work through this pandemic. And I know that's also very taxing on one's own stress levels, one's mental health. Just a massive thank you to everybody that has come together and helped out as far as all of that goes. So I just wanted to touch on those things real quick. But anything to add, guys?
Yeah, I like the people that have had to go out and work during this. I can only imagine how incredibly tough that was. I feel lucky that I could stay at home in some respects. Like, I didn't have to be out there. And like I said, my partner, though, had to work throughout the entire thing. And yeah, it was incredibly stressful on his mental health. Like being in like the full, get up all the time, having to remember everything, being with members of public, which and them not always wanting to follow the rules and trying to keep himself safe, to keep me safe. It was incredibly draining on him, and he lost workmates and friends to COVID, and I would just think, oh, it could be him next. Like, it was very stressful time, and I feel like it did cause some kind of strain on our relationship as well, because I would be very stressed and concerned, and with my germophobia, I wanted to like control
Yeah.
everything and any germs coming into the house, and he was already so over stressed from work that it was just like, and you're only seeing each other and you're stuck in the house together. It was just like it's been a very like stressful time. But the people that have had to go out there and didn't really have a choice and had to keep working through this, and in especially those that work like with the public, like on a day to day, like I can't imagine the mental stress that took and the worry they had, like that at any point they could like catch COVID, and and if they did, they had to like take time off work, or when and just the financial stress and the worries, like it's been so much for everyone, and it's going to take like such a long time for people to get over that. That's a lot of stress
Mm.
and trauma that like builds up in the body. And I feel collectively as a world, it's something like we've all been going through, and so there's just a lot of trauma, a lot to deal with, and it's going to take a lot of time. And I feel we need to remember to be gentle with ourselves and each other, and kind to ourselves and each other, because we've all been through so much, like
Mm.
so much.
Absolutely.
I've found that it's made people in general more aggressive as well as all this. Like, just having been out and about, I found that, like, not everybody, but just in general, a lot of people seem more aggressive and more stressed out.
Yeah,
And
I feel like when people are dealing with anxiety, it comes out like as aggression, especially sometimes to the ones you love, or even to strangers. Like
yeah,
when people are stressed and anxious inside, they don't always mean it, but yes, it often comes out like as aggression. So that, yeah, there has been a lot of that, and there's been a lot of like, because of divide, with like vaccines or no vaccines, or is COVID real? Isn't it real? Did it start from this? There's been a lot of like fighting over that type of thing as well. So it's just been a whole like situation that has just caused so much stress.
Hmm. Yeah. And won't even get into how the vaccination has played into this. The just the mental health around everything that you're trying to deal with on your own, and then on top of that, you've got the pressures of the outside, from everybody's points of view. And I get it too. A lot of people have been cooped up and they have a voice still and they want to be heard. But I mean, that all adds in on our stress as well, whether or not you're making the right choice, whether this, that, and the other. But uh, what was it? Oh, with the parents with children, we were talking about earlier, um, with the schooling and everything getting back to normal. I think there's going to be a bit of, what's the right word here, apprehension in sending your kids back out into the world, and getting back to a normal society with schooling and everything, and getting them, because they're like we were talking about earlier, they don't really comprehend exactly what has happened, some of them of the age groups. And so, I mean, what do you guys think about that? Getting, well, and it doesn't just have to be children. I mean, ourselves too. How do you feel about re-entering into this world after a year and a half of an introvert's dream?
yeah. Like, certainly the schools are back, and they've been back for a while here. And for me, with having Thomas like he is and not having a vaccine for his age, I'm not going to lie, I didn't want to send him back. But then the damage it did to him being off was also really damaging. And I had to work out, like, what is going to be more damaging to him. And I don't know, but certainly here I've figured that, like, everything seems to be almost in a way back to normal. Like, not normal, but a lot of people are acting as if this thing never happened now. Like, you can just walk into a shop and there's no, like, 90% of people don't have masks on, and people are just walking around doing their daily thing. Like, apart from the fact that there's this now fuel crisis and everything going on, but that's a different matter. But everything seems to be going as though it never even happened in some places. And for me, like, I made myself physically ill trying to control what was coming in and out of the house. And I can't imagine how you managed with that, knowing that your partner had to go out of the house and come back in. Because, like, everything that was coming in the house, I was literally disinfecting. And I had a big box outside that I was making sure everything was going in, so that it wasn't coming in until I went out, and I was gloving up. And I took it to the extreme where I made myself very, very unwell. And having to now go out as if things are normal, it's making me ill. and overthink things to the point where I'm now like, I'm going to make myself ill again if I don't calm down with it.
Mm-hmm.
I think the situation in the UK is people are just very desperate to get back to normal. And you know, they're tired. They're tired from it all, but you know, it is still happening, and you know, you still have to take, you know, the precautions that are needed, but people are just tired. They just want it to be over. Who doesn't? They're just desperate to get back to normal and to get things going. But for other people, like say me and you, Gemma, that gives me even more anxiety about going out, because you know, people aren't wearing masks, people aren't staying distance away, and so I just feel even more anxiety to be out now, because there's, you know, it's a strange one, and I think it's going to take me some time before I do, you know, start doing, because I'm like, you haven't done like nearly 2 years to just go out now and you know, catch COVID, and you know, so it's like it's a tricky, like when do you start going out, but like the more I stay in, the worse, you know, your mental health gets, so it's like a balancing act. It's just, it's tricky.
I feel like they took away everything in one go, whereas they should have done it gradually, like say, oh yeah, okay, everything's open, but you still need to wear masks, not just like literally take everything away all in one go and expect people to just get on with it, because it's just
For
like,
me, like, I know like mask is a very I can't say the word, contentious issue. But for someone that wore masks even before the pandemic and will have to wear them after the pandemic, you know, I don't have an issue with them. And so, yeah, personally, I think you should still wear them inside shops unless, you know, you're medically exempt or whatever. But you know, yeah, people, once the government like said, oh, you know, you don't have to, like, recommended you do, but you don't have to. Like, most people's like, I'm done with this now. I'm done.
Yeah.
But you know, it's been hard because people like, okay, I followed the rules, you know, I've had my jabs, I've done this, like, when will it end? They almost expect the government to be able to control corona and be like, okay, you can stop now. But it doesn't work like that. Like, believe me, like, everyone would want it to end, but people are just tired. Like, collectively, people are just tired of it. So I understand it from that point of view, but also, you know, I'm still wearing my mask and, you know, being respectful of people's spaces. And, you know, that's, I think the only thing you can do is control what you do yourself and take care of yourself. You know, you can't control anyone else and what they do. So you can only control, you know, yourself and keep yourself safe and the people around you, you know, to a certain degree. So, but there's like a lot of anxiety that comes with it.
Yeah. Some people can't even control themselves, as I've seen a few times. But yeah,
Danny, sorry.
Yeah.
You've hit the nail on the head that everybody is just done with this. So yeah, as soon as they were saying, we think it's so safe to go outside, they're just ripping the masks off. That's it. But what were you gonna say? Sorry.
I was just going to pick up on Danny's comments. Like, Doe predicted the future. They wore a mask before any of this, but you know, I did see this coming. I remember when we first got the news of what was happening in, you know, China, and it was around March time, and my sister was having a big birthday. This was before it even like got to the UK, or maybe there was a few cases, definitely before lockdown or anything, and I was anxious to go there, and I was like taking hand sanitizer, and I was like, why is no one else worried? Like, can they not see where this is gonna go? Like, I could already see what was gonna happen, what was gonna go. I felt like I went into lockdown before lockdown even started. I could see what was gonna happen. And it was incredibly scary because I felt like no one else was taking it seriously. I feel like at that time, some people even joking about it, like no one took it seriously. I was like thinking, okay, like all the flights need to be stopped now, like ages before. Well, anyone could have said it before Boris. Like, oh my gosh, let's not get into that. But yeah, it was just, it's been a lot, and to think like it's gonna be like what, coming up like 2 years soon that we've been going through this all. And yeah, it's kind of mind-blowing.
It is.
I definitely think Boris was way too slow to react, but
Oh
certainly
my
with
gosh,
the
yes.
like sanitizing thing, I was like, I'd certainly been doing it a while because of Thomas's diagnosis anyway, but I certainly did up the ante when I started hearing things about it. But certainly we were way too slow over here, way too slow, and there were so many people that I feel lost their lives that
Oh my
didn't
gosh, yeah.
need to
I mean,
because they just took way too long, way too
It's
long.
devastating when you think of the amount of lives that have been lost to this. Like, it's just absolutely, and how many families, that has affected, and how many people are like grieving and going through that. Like, collectively, that is such, huge amount that is, that all grieving this loss. And I remember reading every day, like, and people would just talk about it as numbers, and they would forget like each person was an individual with a family, that people that loved them and cared
Yeah.
about them, and each life mattered. And people would just be like, oh well, it's only like older people, or oh, there's only like this many numbers that have died. And I'm like, you need to remember, like, each person wanted to live, each person.
That
It
only
was
could
just
be your
upsetting.
everything. That's the thing. That only could be
Exactly,
your everything.
exactly.
And it's like, it really got to me when they were like, it's only this, it's only that.
Oh my gosh, that upset me. And I know how hard this must have been for you. Like, you and Thomas, like, being very vulnerable with everything that was going on, and like having to isolate like so much. It must have been terrifying for you. Like, absolutely. And to hear people talk like as if people with, like, who were older, or people in care homes, or people with disabilities, like, their lives didn't matter. It
Yeah.
was absolutely like sickening to read that, and to see how quickly disabled or older people were just like thrown under the bus, like, and
Mhm.
their lives didn't matter.
Yeah.
I
Yeah.
actually felt sick reading it, when people would just say like, well, it's only the the people with health conditions are going to die, or only the older people are going to die. Like they didn't
Yeah.
matter. Honestly,
Yeah.
I was disgusted when I saw people speak like that, and I just
Mhm.
feel for everyone. Oh my gosh, it's been a lot. It's
So
been
many
heavy, heavy
unnecessary
times.
deaths everywhere because everybody that should have reacted and had the power to do things sooner just were too slow. And
yeah.
I think they honestly thought the whole herd immunity thing would work and it didn't. And then they like thought, oh heck, we've really messed up here and tried to do what they could, but it was too little too late.
Well,
Like,
Yeah,
and
just
all
too
of
many.
the death and everything that has come from the pandemic is still, it's going to play that active role in the post traumatic stress that we were talking about.
Exactly.
yeah.
Yeah.
So we are coming up on the hour mark, but I would like to take the last few minutes here for Doe to plug the walk again, please. Let everybody know what we're doing or what you're doing. 100 miles.
Thanks, Tim. So yeah, I am going to be walking 100 miles, or 160 kilometers, this October, to raise awareness and to raise money for Mind, which is a mental health charity here in England and Wales. They do some great work, and mental health support is so very needed and so very lacking in funds. So if you want to sponsor me anything, $1, £1, whatever it is, like, honestly, it will help. You can donate at tinyurl.com/vegan dough. Gemma has posted it in the comments there, so go click, donate anything you can. It goes directly to the charity. It is on a Just Giving page. And I think they take PayPal, Google Pay, credit cards.
They
There's
do. It's
some
everything.
options. So
Yeah.
yeah, anything you can donate would be so appreciated. I'm gonna be, hapsing some of these walks as we go, letting you know, where we are, how many miles we've got. We've got 100 miles to do, so it's gonna be a lot of miles. But I appreciate the support. I appreciate the donations that have been done already, and I feel like mental health is very very important. And just as we work on our physical health and keeping our bodies healthy, we have to constantly work on our mental health. It's not something you can just forget about. It's like a flower. You have to keep watering it, and you have to keep working on it, and you have to, you just have to keep going. So thank you,
Absolutely.
everyone that's donated so far. I appreciate you. Thank you so far. Yeah.
And Jim and I would like to thank everybody for tuning in tonight, and thank Joe Darling for joining us for this great conversation. And
Thank you for having me on the show. I really appreciate it.
yes,
Oh, thank you for
absolutely,
coming.
anytime. And we'll definitely be checking in with you on your walk,
Awesome.
especially the ones that you have. So I'll hop in and see how everything is going. Thanks again, everybody, for the awards. That helps keep the show going. And thank you to Ella, my Bunny Valentine, for sponsoring us. You can go to her site as well, mybunnyvalentine.com. Use the code FIREDUDE15 for 15% off little guys like this.
So
And yes, we're gonna wrap it up. Thank you very much. Thanks again, Doe, and we'll see everybody again next week. Don't forget Catalyst Wednesday tonight with Jim in Chicagoland. Only a few fire pits left. And you guys, you two need to get to bed.
I know it's late.
All right, guys. Thanks again. Bye.
Thanks, everyone. Bye.
Thank you. Bye.
Don't you quit. You do make a difference. You do make a difference. You do make a difference. As weak as you are, as tired as you are, as many mistakes as you made, you do make a difference. There is something they would lose if you were not there. There was something that they would miss if you were not there. You do make a difference. You do make a difference. Don't you quit.